I think I was about 6 years old. I was very young when I got diagnosed with scoliosis.
I'm Dr. Matt Alexander, and this is Mylee.
Mylee,
yes. Thank you for coming in today. So Mylee actually works here in town at the Now Massage. Mylee, you were explaining to me that you have been diagnosed with scoliosis when you were a kid.
Yeah.
And so how old were you when you got diagnosed with that?
I think I was about 6 years old. I was very young when I got diagnosed with scoliosis.
And then you said you've had some kind of annoying back pain for a while, right?
As I'm getting older and I haven't been treated for like 8 years, my back is consistently, like the pain is just getting worse.
Yeah. And you're how old now?
I'm 19.
19, okay. So it's definitely something we're gonna wanna look at because at 19, you shouldn't be having back pain at all. And so we wanna make sure that that doesn't continue to get worse as you get older and give you more serious problems down the road, okay? Can you show me where on your body you feel that pain at?
So I get mostly like upper back pain.
Like right in here?
Pain.
Okay.
Yeah, and then definitely like in my shoulder area.
Shoulder blades.
And then lower back.
And the lower back too.
Also super painful.
Okay, wow, multiple spots. Okay.
Yeah.
So what we're gonna do is we're gonna go ahead and check your posture out, your range of motion, and then I'm gonna have you lay down on the table and I'm just gonna feel your joints and see how they're moving. See if I can feel anything out of alignment or that's just stuck and not moving the way that it should, okay? So I'll start with your arms to your side here. Okay, so the first thing I notice is you have a right shoulder high, and that could be a sign of the scoliosis, but your head is nice and straight. I'm gonna come and check you from the side here. And I also notice you have what we call a forward head posture. So the center of your shoulder here should line up right with the center of your ear. And so you're about an inch and a half forward. And so that forward posture like that is gonna put a strain on your neck, and it can even cause strain down all the way down to the lower back as well. Yeah. It just moves your whole center of gravity forward. So I'm gonna check and see, can you turn and twist all the way to both sides? Do you feel any tightness in your back at all when you do that?
Kind of, yeah.
Okay.
I do.
And what about tilting side to side? So I want you to tilt as far as you can go there. And then I'm gonna check here and then do the other side. And we'll go there. Good, back up. Okay, so you go lower on the left side than you do on the right side. So that could also be a sign of just some imbalance in the spine. And then the next test I'm gonna do is called the Adams test. I'm gonna have you go down straight forward. So you're gonna put your hands together like this, and I'm gonna have you bend all the way down and just stay down there like, all the way down like you're diving down.
Okay.
Okay, just stay right there. I'm just gonna move your hair to the side here so I can see your back. Okay, so I do see the curve here. It bows out to the left side in your lumbar here. And it does travel up to here, but it seems to be mostly here. So I'm gonna have you come up.
Okay.
So let's go ahead and check and see how it's moving, okay?
Okay.
So now I'm gonna have you lie down, face down here on the table.
Okay.
So we're gonna start out actually checking your feet. And they do look level, so that's great. And then we're gonna check your SI joints here and just see how they're moving. If anything hurts, let me know, okay? Okay. Do you ever get the pain down in here?
Yeah, definitely.
Okay. Okay. Yeah, I can definitely feel the misalignment in there. And then definitely stuck right in there, about T8, 9 there. And that travels right up into between your shoulder blades. Good. Do you ever have any neck issues at all?
All the time. It's
really?
so bad, actually.
Okay. Yeah, so definitely at the base of your neck there, we have some tightness as well. Okay, why don't you go ahead and sit up for me?
Okay.
All right, Mylee, so after checking you out, you do have a curve in your back for sure. I think it would be a good idea for us to measure it since you haven't had it checked since you were a kid. So we can go take a quick x-ray. We have digital x-rays right here on site, and then we can take a measurement off that x-ray and see where it's at and see if that might be what's contributing to the back pain that you've been having, okay? All right, Mylee, so let's start from the top. So your neck here from the side, it should normally have a curve to it, like a C-shaped curve. That's called the cervical lordosis. And notice how what does yours look like?
It's very like, you got that forward posture.
Yeah, it's got that forward posture. It doesn't have the natural curve to it. Now the good news is you're young and all your joints look very healthy. And so if we can induce a more natural curve in there, that's going to help a lot with your neck pain, and it's going to prevent future damage to those joints, okay? So the way that we would fix that is through three things: chiropractic adjustments, at-home stretches and exercises, and at-home traction. We have a tool called a Deneroll, and it's like a foam block, and you lay on it for a few minutes each day, and there's really good research showing that it can help to reintroduce that natural neck curvature, okay? It's not an overnight fix, but you know, if you do it consistently, you know, I would say for a neck like yours, probably at least 6 months, you'd want to do that consistently. Okay. Now, as far as the chiropractic goes, we would treat it more aggressively in the beginning and then taper off as we went along. Okay. And then for your mid-back, this is where your scoliosis is at. And so I took a measurement at it from the top of your L2 and 12, 11, 10, and the top of your T10, and we did a measurement called the Cobb angle, and that's how you get, it's one of the ways you can get the measurement for a scoliosis. And what I have on yours is a 28-degree scoliosis. So anything over 20 is considered clinically a scoliosis. So you do have that condition, and it is blowing out to the left side as we suspected. There's good news and bad news with that. The good news is it's not going to rapidly progress like it would if you were a younger teenager. But the bad news is it's also harder to correct at this point. There are certain types of tables where we can put straps on you and actually pull and push that spine into what we call a mirror image. So we basically put straps on it and we'd stretch it in such a way that it was in the opposite direction. Realistically, if we can knock a few degrees off of that, if you can take it from, you know, 28 to 18, it's no longer clinically a scoliosis. It's just a lateral curvature. It would reduce the visual size of it, and you would also feel a lot less strain on your spine. And so the more we can take out of that, the better you're gonna feel, and the better outcome is gonna be for your spine in the long term. Does that make sense?
Yeah, not at all.
Okay, so let's just quickly go over a couple others. So the lumbar one here, now that's where it really curves out to that left side, and that's why when I, you know, had you, when I was checking your posture in there, you were like this, and you had that gap on the one side, and you didn't have the gap on the other side. That's why. Does that make sense? Can you see how mine has the gap? And that's we're looking at you from behind here, so this is the left, this is the right, and that's why you have that posture. So, so that kind of, we call that like a lateral translation. That we could take some of that out with the traction. And there are also exercises you can do at home that are called mirror image exercises, and I'll show those to you. But basically, you'd take yourself from this posture and you shifting over to the other side, and you're holding it for a few seconds. And through doing that, we can help to. It'll stretch the right muscles and strengthen the right muscles to help hold you more into center. Going to be very important for you to keep a strong core probably throughout your lifetime as well. Okay. Any questions about that? No. All right. I do think this is probably what's contributing to a lot of the aches and pains you're having. And that would make sense why it's over time feeling worse, because it's probably gotten worse. Even though we don't have your old x-ray from when you were a kid, it's likely that it did progress throughout the teenage years, because that's the normal progression of scoliosis. They tend to develop more between, they kind of start between the ages of 9 to 13 usually. You start a little younger than that. And then during those early teenage years where you're growing, that's when they tend to progress. Good. You're going to feel the back end of the table move up and down, okay? Is that okay for you?
Yeah.
Good. Okay, this is called flexion distraction, and this is going to help loosen up your lower back, okay?
Okay.
You all right with that?
Yeah.
Okay. So the type of exercises that are going to be great for you are going to be core exercises like planks, bridges. There's a great exercise called a bird dog. Nice, good. Okay, and then let's go ahead and have you lie down, face up. And then I'm gonna put my hand underneath you and press down, okay?
Okay.
There we go.
Oh my goodness.
Good, I think we got it all there. So I'm gonna bring you over this way. I'm just gonna give you a little push here, okay? Just like that. Very good. Cool. Alrighty, let's go ahead and have you stand up.
Okay.
And then why don't you just move around and everything, make sure everything feels okay.
Okay.
Doing all right?
Yeah.
Good, a little looser there?
It feels better, yeah.
Yeah. Yeah.
Thank you.
I mean, it's a work in progress for sure with something like you have going on.
Yeah.
But that will cause an immediate loosening up of the muscles and joints.
Definitely.
Okay, Mylee, just remind us why you came in here today.
I just experienced a lot of back pain, and I just wanted to check up on how my body was doing in general. I was also concerned with my posture.
Now, what did you get out of today? Did you get any good information out of today? And how was your treatment and all that? What did you learn about yourself?
I was definitely told a lot about what I can do to help with my posture in the long term, and I will be using that advice. I want to fix my posture.
Yeah.
And just recognizing how my back is doing, and like just noting that fixing it now is going to help me a lot in the long term, since it's going to take a while, since my body is at the mature age, I think is what you said.
Skeletally mature.
Skeletally mature. So
how important is your health to you?
Oh, very, very, very important.
Yeah,
I try to take really good care of my health on the regular, but I've definitely been neglecting my skeleton.
Yeah, we got a lot going on in our lives, right?
Yeah.
But ultimately, if we don't feel good and can't take, our own health is poor, we're not going to be able to do the other things that we need to do, right? Yeah. And so going forward, I guess my question for you would be today, with the treatment that you received, how did you feel? How's your body feel now?
My body feels a lot better, definitely. Like, it doesn't feel as tight, definitely feels a lot looser. I feel like I can move more.
Oh, good. Cool.
So, I actually already feel like my posture is looking a little bit more up,
nice.
Too.
What would you say to anybody out there that is thinking about checking out chiropractic and maybe looking into coming to Alexander Chiropractic? What would you tell them?
Yeah, like if you're concerned with your health, if you're concerned with your posture, getting it fixed now is way better than doing it later. So dealing with it now is ideal.